okay, we diagnose the disease. Now, okay, here our India, our Tamil Nadu, what they do is they inform the labs will inform the corporation. Okay, the corporation authorities will contact you. Now that most of the here local population, what they are doing is when they are asymptomatic, there is no symptoms, I think they are taking the chest x-ray also to find out, okay, overall lung is okay kind of. If you are okay with this chest x-ray is clear and your symptoms are no, don't have many symptoms, then they'll allow you to do a home quarantine. Okay, the home quarantine. Okay, when you are in home quarantine, this is what I gave on TV channel on interview. What is the advice for you, doctor, when the person is in home quarantine? Okay, this is the toughest situation for anybody. Okay, say example, you have one son and daughter, and your wife and some adults are there in the family. You're going to isolate yourself in a room, okay, which is contagious, and we don't know who is going to become sick if they get the infection. So first thing what they have to do is they have to isolate themselves very well so that other people won't get the disease. So then comes the mask wearing. Okay, the normal mask, the cloth mask, what most of the people using in a lot of style it is coming nowadays, is completely rubbish. Okay, it won't even prevent one virus particle going inside the mask. Okay, so it is completely rubbish. That the cloth mask is definitely should not be used at this setting, especially when the one person is already affected by COVID. So everybody at the home have to use N95 mask for sure. Okay, that we are going to talk about the mask separately, but this is called N95 mask. This N95 mask has some kind of a clip here, so we can press it over the nose like this so that it will be very much sealed. And you should not use the N95 mask with a respirator here.
Okay, because
I think I have one mask here. I'll show you. It's not N95, but I want to show how is the respirator thing. These kind of respirators. Okay, this is not N95 though. See, what happens is this kind of respirators allow the air to escape from here outside so that it's easy for you to breathe. That too, like even if you wear a surgical mask like this, even you can breathe, it protects you from almost 50 to 60% protection like a N95. Okay, what happens is this allow you to breathe through all the opening side in the sides.
Right.
Okay, so it is not much dangerous. But when this kind of a respirator is there, it tends to push the whole thing in the same place in a high intensity. Okay, this is worse than like wearing a normal surgical mask. Okay, so you should not use the N95 with the respirator. You see, even I met one of my friend today in the shopping mall, the grocery store, and
which shopping mall did you?
I should not get into trouble. I went for the nearby grocery store, and there she's telling me like she's wearing a normal mask with it will be below this level. Okay, and I asked her why. When I wear a N95, she's also in the medical field. When I wear an N95, I can't breathe. I feel kind of fainting. Okay, it's very common. Even before this COVID, none of the doctors use the mask properly. You understand? Okay, we don't care about it. So now when you started using any new thing, it will be a problem for some time. So only initial stages, you buy the mask, you practice yourself at home. Use it for 10 minutes, see how you are feeling. And after that, increase to 20 minutes, then 30 minutes. Today morning, I did a surgery using N95 over that one more mask with PPE for 1.5 hours. When you are trained, then it is easy for you. You got it. So the first thing what that home quarantine people have to do is all the family members have to use N95 mask without fail, because even the person is inside the room, they find out the virus particles in the corridors, the hall or wherever. So even if he is inside the room, doesn't mean that you are safe. They have to wear the mask unless otherwise 2-3 rooms apart. Right. So you have to use the mask for sure, N95 mask. And same way, all the food, whatever they are giving from home, one person has to go and deliver the food, and he has to wear mask. And even possible, they have to use a face shield.
Correct.
This is called face shield. You see, better than this face shield, what I advise is they can buy the, like when we are driving the two-wheeler, we used to buy this helmet kind of thing, no, the visor.
Just like a
That
visor.
will be easier. Yeah, they have to use a visor. They can wash it with the soap and water and keep it in the night, and they can reuse it. So they have to cover the N95 and this one. Then only they have to go on give the food. That is very, very important. Need not put the glove. People are, like misunderstanding the use of glove, because when you wear a glove only, you do a lot of mistakes. You touch there, you again come and touch other places.
Yeah.
Like you don't properly know how to use the glove. So people better not to use the glove.
Just wash your
You
hands.
go on, yeah, wash your hands or use alcohol rub as soon as you come out of the place. Okay. And same way, when you're disposing that, like all the disposable, better to give in disposable plates and other things so that you can throw it everything.
Yeah.
So you keep it a separate bag. Now corporation will come and give instruction to the each and every house who are all infected by this. How to dispose those infected material is a separate thing.
Okay.
So you have to keep it, and corporation will collect it, or that apartment has some rules, or that how that area has some new separate rules. You have to ask the corporation people how to dispose.
Okay.
That is also very important. So when you are disposing the things, probably they can use the glove and dispose and come back, remove the glove and wash the hand properly.
Okay.
Okay, this is a very important thing. This is for the people inside the house. Okay, take it seriously, because the person above 50 years in the family, the 25 years guy got affected. The big responsibilities for the 25 years guy, because he should not be the reason for the elders, mortality or whatever. So we have to be very careful about it. Second thing, for the guy, what are the things he has to do? Okay, so the person who is in home quarantine, what are the things he has to do? First thing is, don't panic. And it's like less than 1% is the mortality rate. Don't panic, and follow few simple things which increases your immunity. First thing is the doing pranayama.
Okay.
Pranayama is the one best exercise during this time, because I spoke about the cytokine storm earlier. You remember?
Yes.
The cytokine storm. Okay. See, the pranayama is a good exercise at this time, because we already discussed about the cytokine storm. Why it is happening, the cytokine storm? It is because the excess of immunity will send a lot of cytokine at this place, so that it destroys the nearby structures. To balance this immunity, how much has to go on, just balance the energy, you need this pranayama. You do alternate the nose breathing. You remember that alternate, the concept in yoga is your right side brain is like male dominant kind of, left side is a female dominant kind of. So the action, all those things is the right side. Left side is like the creativity and all those things is left side. When you're doing the alternate breathing, that your body is balanced. Okay, so this much immunity alone is needed for this infection, like kind of that kind of the balancing act will be happening because of the pranayama.
Right.
And same way, when you are doing the kapalapati, like you push the breath out. Okay, that also pushes all these unwanted stuffs in the lungs. If you scientifically speaking, see, these are all the techniques. Though it's a yoga and the pranayama and all discussed among these Gurukul and other areas, but these are all scientifically proven methods. People have to understand it is not like we are giving medicines. It's proven. How will you say pranayama will help? I take a multivitamin tablet, it will be adequate. People should not think like that. Pranayama is completely scientifically proven technique. Okay, then only people will believe it.
We want something tangible, no? So when you have a physical tablet in your hand, you've taken the vitamin, it's tangible. So you feel like, okay, I have done something. When it's not tangible and you're just breathing, you feel like, have I really done something? Have I accomplished something? So I think it's just human nature to say.
So the person inside the home can do a pranayama to increase the immunity. As I said, it is scientifically proven. So definitely they can very much benefit it, because when there is a disease, you have to take rest. you should not do much of exercises like going for a walking inside, doing a treadmill. All those things you should not do. Take adequate rest. That's very important. So the only breathing exercise allowed. Eat healthy foods which prevent inflammations. Okay, that lot of that stored food, like processed food, all those things will increases your inflammation level. That is what bad during the coronavirus infection. The inflammation is the reason for the lung involvement. The cytokine storm also produces inflammation. So we have to eat foods which reduce inflammation. So a lot of vegetables,
From there.
See, the food what he has to take is lot of vegetables and less of processed foods and the meat.
Okay.
Because the processed food and the meat will give you the body will give you a lot of inflammation for this kind of a foods. So the inflammation is a thing which is dangerous for our body during this COVID. Even the cytokine storm will produce a lot of inflammation only. Along with the bodies, whatever we take also in the inflammatory state, you are highly prone for the lung damage. So eat very less of the inflammation producing cells and lot of foods and a lot of vegetables. That's what your food has to be.
Just go online and say foods to eat to help with inflammation. Is this information easily available? It is, I'm assuming.
Yeah, it is available. It is easily available. You have to understand that. So other thing is, yes, multivitamin and like whatever people say, just follow it. Kapasura Kudineer and all these, like homeopathy, Ayurvedic.
It doesn't
follow as long as it is not giving any kind of a side effects. Even homeopathy medicine works really well for viruses. I know personally I use for a lot of other ailments also. So even homeopathy, they give a medicine for 3 days in empty stomach. That also say that it produces longer immunity. So you can use everything, nothing wrong in it. So since allopathy doesn't have a much solution for this, nothing wrong in taking whatever you want. Okay. So I believe in other medicine, other types of medicines also. So I support it. Okay. So when you're doing all those things, what is the end to it? Okay, if you are finished 2 weeks, like usually they say 10 days quarantine or something. After 2 weeks, you are free to go and you're protected. Okay, see the other thing what you have to understand is it's not the full protection. What you got it. This virus, that immunity is going to be there for only 6 weeks to 3 months, not more than that.
Ooh.
Understand that. If you are not following, see, a lot of people are very careless. Once that virus infection came and they come out, they said, I am free. No, not at all. You are free only for very limited time. Understand this.
I've done something again. I'll go and tell everybody this now. People feel like once you've got it, then you've got it. You're done with it, for life.
So other taboo will be there. You have to understand this. Everybody are so much worried because they should not want to get the infection. When you go out, people are afraid to talk to you because the awareness is very less. You have to go through it, but understand that feeling also. So better to isolate yourself for a longer time socially than wanting to go out immediately. You have to understand that.
Okay.